we understand what are sickle cell disorders and how do they actually affect the body. So in order to do that, we need to understand how do red blood cells work in a normal person. So in a person who has normally functioning red blood cells, the red blood cells are nice and circular. They have hemoglobin, which is able to pick up O2, and then in capillaries such as this one, they'll deliver the O2 into the surrounding tissue, and then continue moving on throughout the capillaries and go back to the lungs in order to pick up new oxygen. In patients that have sickle cell disorders, their cells are able to pick up O2 normally and deliver the O2 normally, but after that, they turn into this rigid sickle cell shape, which is where the name comes from. And this is due to a single DNA mutation in the hemoglobin, and it causes this shape to form. And there are several things that can happen when this shape occurs. One of those things that can happen is a vaso-occlusive crisis. And what this is these rigid-shaped cells will get stuck in the walls of the capillary, and they'll kind of form like a big clump and a big blockage, which will restrict blood being able to flow. So if blood isn't able to flow, there are a couple of things that can happen. One of these things that can happen is ischemia. And ischemia is when the cells are don't have adequate blood supply, and without adequate blood supply, they don't get enough oxygen, and that will cause them to produce lactic acid. So if you've ever gone running and you've gotten like a cramp in your leg or some type of pain in your muscles, that's due to them not having enough oxygen and producing lactic acid. So in someone with sickle cell anemia, this happens to them all the time without even having to do any form of exercise. Another thing that happens is that this clumping of these red blood cells will cause cell damage along the capillary wall, and that will cause your body to go into an immune response and cause inflammation. And so both of these factors together can cause intense pain for the patient that's experiencing sickle cell disorders. Another thing that people with sickle cell disorders can face is that they have reduced autonervous systems and sympathetic nervous systems. And these two are really important in order for a person to be able to dilate and constrict their veins. And this is important because if something like your cells aren't getting enough blood, your veins would want to dilate so that way more blood can flow through. But in patients with sickle cell disorders, these symptoms are altered and it's much harder for them to constrict and to dilate their blood vessels. So they have less control over being able to correct something like a vaso-occlusive crisis where areas aren't getting enough blood flow.
When we were reading the pain diaries, we noticed a lot about how these patients were describing a consistency and a longer duration in their pain. They were saying how they were constantly feeling pain. So we wanted to address that. With sickle cell anemia, we have the red blood cells that are distorted into the sickle cell shape, and that allows them to get caught in the blood vessels. It causes a lot of tissue damage to the blood vessel wall and inflammation, which will result in the secretion of prostaglandins. And what prostaglandins basically do is that they increase the amount of ischemia-induced pain signaling in the body. So in order to understand what signaling is, when we talk about signaling, we're talking about the ways that neurons will interact with the brain. And the way that they do that is by sending signals called action potentials through their axons, and they'll kind of line up and they'll all send this same signal, and it'll eventually reach the brain. So with prostaglandins, when their prostaglandins are secreted in response to this stress and this tissue damage, they will in turn increase the activity of a channel called the H channel. And the H channel is something that will increase the amount of action potential firing and will repetitively induce action potentials. So what we have here is we have the sickle cell anemia stress, we have the secretion of prostaglandins, the increase in H channel activity, which will then cause the repetitive activation of action potentials. Action potentials will be sent along the neurons to the brain, which will result in a constant stimulus to the brain. And because the sickle cell anemia is also causing the ischemic pain, we have excessive amounts of stimulus that's associated with ischemic pain, so the brain is feeling constant pain, and that sensitivity to constant pain is called hyperalgesia.
two symbols came up from the pain diaries. The first one is sports. The reason that the children reference sports is because exercise induces pain for them. This is because exercise induces ischemia. A way to fight against ischemia is to vasodilate our blood vessels. However, children with sickle cell disorder already have a difficult time regulating vasoconstriction and vasodilation. That means when they exercise, they induce even more ischemia, and it intensifies their already ischemic pain. The second symbol is pressure. This is because applying pressure can ease the pain. This is through the gate theory of pain. The gate theory basically says that you can have two signals compete against each other for recognition in the brain. So for children with sickle cell disorder, they're going to have a signal for ischemic pain, but also a signal for applied pressure. In this case, pressure is going to diminish their pain that they feel, and that is why they want pressure put on their body to relieve their pain.
So in the pain diaries, the patients with sickle cell anemia were commonly describing their pain as sharp, and there was this overarching image of feeling like they were being stabbed by someone, or nails were getting hammered into them. So we kind of want to make physiological sense of why they're feeling this pain this way. Sharp pain is transmitted, the signal of sharp pain is transmitted to the brain quickly, so immediately upon input of a stimulus. The signal is transmitted to the brain, and then it affects pain. Dull pain is, the signal is transmitted more slowly, and this pain could often be described as ache and soreness. So perhaps think that you're getting slapped in the face. Immediately upon the slap, you feel this sharp stabbing sensation on your cheek. That is because the signal is getting transmitted quickly to your brain. Then, perhaps a little while later, your cheek feels sore and achy. This is the slow signal of pain getting transmitted to your brain. Ischemic pain is generally described as feeling like stabbing pain, so we can speculate that ischemic pain signals are following this quick pathway to the brain.